So, today we'll begin a simple primary care review on COVID 19. Transmission. Direct person to person respiratory transmission is the primary means of transmission. It occurs mainly through a 6-foot close range contact via respiratory particles. The virus is released in the respiratory secretions when a person with infection coughs, sneezes, or talks. Infection can occur through contamination through secretions or contaminated surfaces, touching of eyes, nose, or mouth afterwards. However, contaminated surfaces are not thought to be a major route of transmission. Incubation period. The incubation period for COVID 19 is thought to be within 14 days following exposure. Clinical presentation. Clinical presentation can range from an asymptomatic infection to life-threatening respiratory failure. The symptoms are present approximately 4 to 5 days after exposure. Most symptoms include fever, fatigue, dry cough, myalgia, and headache. Loss of taste or smell is strongly associated with a positive COVID. Gastrointestinal symptoms are uncommon. Rhinorrhea and sore throat are less common. Pneumonia is the most severe disease. And acute respiratory distress syndrome, also known as ARDS, develops in a minority of symptomatic patients. ARDS is the leading cause of death, followed by sepsis, cardiac complications, and secondary infections. Complications and associated syndromes. Cardiac troponin elevation, which is a biomarker of myocardial injury. Arrhythmias, most are asymptomatic. Heart failure is the most common symptomatic cardiac complication. Hypercoagulable state associated with an increased risk of venous thromboembolism. Cutaneous findings include an exanthamatous rash, perineal-like acral lesions, livedo-like lesions, retiform purpura, necrotic vascular lesions, urticaria, vesicular eruptions, and arrhythma multiform-like lesions. Persistent physical symptoms following acute COVID-19 include fatigue, dyspnea, chest pain, cough, headache, joint pain, dysgeusia, myalgia, and diarrhea. Common psychological and cognitive symptoms include poor concentration, insomnia, anxiety, and depression. Thank you.